One of the more positive trends we've seen in the 21st century is certainly in Europe and now to a broader degree back home in the United States, we're seeing that we're taking a public health approach to substance use instead of a criminal approach. And one of the first countries to do that was Portugal. About 2001, Portugal decriminalized the personal possession of all drugs. You name it, cocaine, marijuana, heroin, all drugs, no longer a criminal offense. What does happen is if you're caught with that amount of drugs in Portugal, they will bring you before a panel, and that panel is not made up of law enforcement, is made up of public health officials, of doctors. You come in for a short interview, they explain to you the potential health ramifications of your substance use, and they offer you access to rehabilitation programs to help you quit should you choose. And then at the end of that, you decide, no, that's not for me. They let you go about your way. But what they've seen in practice is a large percentage of these individuals, when you don't treat them as criminals, when they're not horrified of being arrested and thrown in a jail cell, the ones especially that have the very problematic use rates are happy to have the help. And they've seen a high adoption of individuals accessing those health programs, rehabilitation, and other programs to help them quit. And what Portugal ultimately saw was drug use in many ways went down. But even more importantly, they saw a decrease in the issues that prohibition had created. For example, intravenous diseases that are spread through needles that are commonly associated with individuals who consume heroin intravenously. Those diseases largely fell off a cliff in terms of the growth rates among the population. A lot of the crime that went along with it went down as well. And in the United States, you're starting to see some similar impacts from the public health approach. Not only are many places, lowering penalties, they're criminalizing things like mushrooms and other substances, but simply the legalization of marijuana alone has led to a decrease in opioid use rates in the population. And that's because marijuana has been studied and seems to be more of a terminus exit drug, unlike the gateway drug they always thought it was. And it has a lot of the same pain relieving qualities that you could get from opioids, but with a lot less health ramifications and a lot less rates of addiction amongst it. So doctors are even beginning to use that as a way to help wean individuals off opioids and help really dial back this devastating opioid epidemic we've seen in this country.
I mean, treatment is a component of harm reduction, and Europe has always been ahead of the United States in terms of making treatment available, but that also, I think, speaks to the healthcare systems in Europe and how they differ quite a bit from what we have in the United States. But within, in a number of places in Europe, they actually allow supervised consumption sites, or sometimes they're called drug consumption rooms. And these are places where individuals can, they'll take drugs that they've purchased on the street, and they can use them in this facility where there's someone, with medical training who can monitor them. So if they overdose, they can administer oxygen or naloxone. And it's a way to try to, reduce the harms, reduce the probability that someone overdoses and dies. But it's also a way of potentially building relationships with individuals who are marginalized. And, most of these places, they don't force anyone to go into treatment. But if someone wants services and wants to go to treatment, they've already kind of built that relationship, so they have that there. You also see some places using different types of medications for opioid use disorder. Where here in the United States, much of the focus is on buprenorphine or methadone as being prescribed for those individuals who have an opioid use disorder. And those medications are quite successful for a lot of people, but they don't work for everyone. And so in some places in Europe, they've actually gone as far as to actually prescribe heroin, or it's called diamorphine. And, it's medical grade. And so they're going in 2-3 times a day and injecting under supervision. And I've been working with a team that's been reviewing the evidence. And there've been at least 10 randomized controlled trials, which have compared kind of prescription heroin to typical oral methadone. And the findings are quite positive for the heroin-assisted treatment. For a lot of people, it just it kind of helps stabilize their lives, right? Whereas they're spending a lot of their time either under the influence or trying to get money to buy more drugs. If they can get access to the prescription heroin, it just makes things easier for them. And there's some studies showing that it reduces crime. They can improve certain health outcomes. But that's not allowed here in the United States. And I definitely think it's time to do some clinical trials, because to me, it's not entirely clear whether or not we would see the same effects in the United States that we've seen in other countries. On one hand, most of those studies were done in a world without fentanyl. And fentanyl and other illegally produced synthetic opioids is really what's driving overdose deaths today. And so it's not entirely clear to me you would see the same effects. But also, outside of the United States, they just generally have better healthcare systems. So if someone's life is stabilized and they decide that they actually want certain services, it can be a lot easier for them to access those in other parts of the world. And so I definitely think it's time to start doing some clinical trials. This isn't a silver bullet, but as I said, there are some medications that don't work for individuals. For some people, abstinence-only programs don't work. And so, and prescription heroin is just one example. There are other medications that are used outside of the United States that it's worth at least trying them here in the United States to see if it might help, in terms of giving physicians a larger toolbox to work with when they're trying to help those individuals who are seeking help.